Let's jump right in. Welcome to today's Explainer, everyone. Today, we're taking a radically different, honestly kind of game-changing approach to how we view our well-being. We're going to completely reframe your health. It's not just some static condition, right? It's a dynamic, complex enterprise. And the absolute most important question here is, who is actually running this enterprise? By the end of this Explainer, you're going to walk away with a completely new operational blueprint for your life. Okay, let's dive into this. Seriously, ask yourself honestly, who is actually managing your health right now? Do you truly possess autonomy over your physical and mental well-being? Or, and let's strip away the illusions here for a second, are you simply taking orders from a massively complex healthcare system? I mean, for most of us, we've been conditioned to wait for a problem to pop up and then just hand over the reins to someone else to fix it. We basically outsource the responsibility. But what if that entire approach is just fundamentally flawed? And this brilliantly illustrates the exact mindset shift we're talking about today. On the one hand, we've got the outdated model, the passive subscriber. In this setup, you're merely a recipient of healthcare services, just constantly reacting to illness as it pops up, firefighting basically. But on the other side, we have the proactive CEO. Now, this requires an entirely new approach. Instead of waiting around to get sick, you're actively managing your stock of health capital. And notice that this stock isn't just physical, it includes your mental and social well-being too. You aren't just a patient anymore, you are the chief executive of your own vital resources. Section 1, the medicalized paradigm problem, treating symptoms, not people. Now, to really understand our current health enterprise, we've got to look closely at this medicalized paradigm. Look, the modern medical system is incredible in a lot of ways, but it has a built-in blind spot. It is heavily focused on reacting to specific disease markers. Think about it. You go in, they look at your numbers, they treat the isolated symptom. Bam. But if you don't actively push back against this medicalized paradigm, you're running a massive risk. You risk being managed as a mere collection of symptoms rather than a whole integrated person. By only looking at the localized issue, this system frequently overlooks the deep underlying root causes of chronic disease. It's a paradigm of reaction, not prevention. And overcoming it, well, that's absolutely crucial. It's our primary goal. Moving on to Section 2, stepping up as CEO, reclaiming your internal authority. So how exactly do we step into this role? Honestly, it requires a kind of hostile takeover of your own healthcare, and that starts with autonomy. To be a successful CEO, you need this autonomy. But true autonomy goes way, way beyond just signing a medical consent form at the doctor's office. It is the absolute recognition that you are the primary architect of your health outcomes. Yes, sure, biological and environmental factors exist, but autonomy is this defined internal authority. It's your power to purposefully allocate your resources, your time, your energy, your focus, and your social capital. And you must direct those resources toward states that build your resilience, while actively cutting ties with the things that deplete it. This whole new CEO mindset really boils down to two core requirements. First up is self-governance. This is that internal mandate where you consciously prioritize your long-term well-being over short-term gratification. You make the hard choices today for a healthier tomorrow. The second is critical engagement. A true CEO does not just blindly accept protocols handed down from above. You analyze the information you're given, you query the evidence, and, most importantly, you demand personalized strategies that actually align with your specific life goals, not just some one-size-fits-all treatment plan. Section 3. Your board of directors. Let's move to this and see how this builds on the internal and external forces. Because as CEO, your health is rarely a solo endeavor. You actually have a board of directors. These are forces that constantly influence your health outcomes. Here are three of the most powerful forces sitting on that board right now. First, psychosocial determinants, things like your social status and support structures. Second, that medicalized paradigm we discussed earlier, which is constantly trying to pull you back into just managing symptoms. And third, information asymmetry. This one is absolutely crucial to understand. Healthcare systems are intentionally designed to be complex. The professionals have the data, and the patient usually doesn't. So as the new CEO, you have to actively bridge this gap by seeking out accessible, high-quality data to make informed executive decisions. Now, what's really interesting about this slide is how the first force, those psychosocial determinants, is framed. We so often dismiss social support and positive emotions as just, nice, warm feelings, but the health capital model emphasizes their immense biological power. They act as actual buffers. These positive states are literal biological regulators that step in and mitigate the physiological damage caused by stress. Think about it. Your social structures are just as much a part of your health capital as your diet or your exercise routine. Crazy, right? Section 4, overcoming subscriber mindset barriers. Let's get into the turnaround strategy. All right, let's walk through your new turnaround strategy. Think of this as your visual cheat sheet. First, the barrier of passivity. The CEO's strategy here is to shift from just taking orders to actively asking for options. Always, always demand to understand the why behind any medical intervention. Next is psychological stress, which feeds chronic inflammation. Your strategy here is to leverage that social connectivity and sense of purpose we just talked about to actively dampen those cortisol-driven stress responses. Then we have material or societal pressure. You got to recognize when your external environments are draining your health capital and proactively cultivate replenishing microenvironments, like better social circles and healthier daily habits. Finally, the barrier of systemic complexity. The CEO strategy: become the head curator of your own health data. So the crucial point is this. When you maintain your own longitudinal health record, your own data tracked over time, you fundamentally change your relationship with the medical establishment. You stop viewing doctors and practitioners as the final decision makers who just hand down edicts you have to obey. Instead, you start viewing them as specialized consultants. You bring them in for their expertise, you listen to their counsel, absolutely, but you, as the CEO, make the final call on how to allocate your health capital. Which brings us to Section 5, the executive mandate, turning the paradigm on its head. Stepping into this role is not some casual, overnight shift. It requires real bravery. As the source material states, becoming the CEO is an act of reclaiming your life from the cycle of medicalized reaction. I just love that. This mindset requires you to establish a totally new foundation. It takes courage to prioritize your own mental and social stability, recognizing that they are the absolute foundation for your physical health. You are no longer waiting for the machine to break down to call a mechanic. You are optimizing the entire enterprise from the top down. As we wrap up this explainer, I want to leave you with a provocative question to really fuel your immediate next steps. Look at your life right now. How will your personal social environment support this new CEO discipline? Are the people and environments around you replenishing your health capital, or are they draining it? Think about your immediate microenvironments today and ask yourself what executive decisions you need to make right now to protect your enterprise. Thank you so much for joining me on this explainer, and I will see you next time.